Welcome, everyone, to this edition of the Compliance Compass, and we continue our conversation regarding physician compensation. And if you remember, we're kind of making our way through that life cycle, and today we're talking about operationalizing a contract. So we've talked about agreeing to terms, how to create a compliant contract, but now we're in that place where we've made a contract. So I'm just going to actually use an example. And we're going to kind of walk through that. So this might be the example. Let's say that you have some employed oncologists and your agreement that you've come to term that your legal department has helped draft for you is an arrangement that includes a base salary. It includes multi-tiered RVUs as well, meaning a different RVU rate when certain thresholds of RVUs have been reached. There's also a pooled arrangement with the other oncologists. So some of the RVUs or some of the productivity goes into a pool, and then that compensation gets redistributed. And your attorneys have figured out how to do that in a legal and compliant way. Let's say that these oncologists also have call coverage and that there's some sort of extra compensation for call coverage. Maybe mid-levels, advanced practitioners are involved as well, and even a medical director arrangement to cover quality. So there's one or more of the physicians. You have this arrangement where they have certain administrative oversights and they get compensated for that. That sounds pretty complicated. And in fact, it is, and it is pretty normal. I've seen quite a few arrangements like that. So here's some of the things that you have to consider. What are the source of those CPT codes? As a physician is treating patients, where is that coming from? Is it coming from your EMR? Is it coming from a different source? How do you get those RVUs? And how do you carve out those RVUs? You've got to make sure that, especially in the oncology, where some of the services they may be doing may also have a technical component to it. Of course, we know you can't pay for designated health services according to the Stark Law. So how do you go about carving those out and making sure you don't accidentally pay a physician for pieces or designated health services that are not allowed by the law? Who approves the call coverage to make sure that the physician has performed according to the contract and fulfilled those minimum number of shifts that are on that schedule? And what about who approves the timesheets? As a medical director, the industry standard for tracking that is timesheets. And who does that? Who makes sure that those administrative duties have been performed according to the contract? So when you think about all of those, who should be involved? Well, it could be IT and data analytics. They may be the ones that are the experts at pulling that data. Likely, they're going to construct a report that somebody else is actually going to use, but at least at some point, they have to be involved. Your practice manager. Now, I have heard in many instances where this can really cause some consternation because providers don't feel comfortable that practice managers know their contracts. I personally think there's a way to do that where you don't have to share the total amount of compensation, but the construct of that compensation and the RVUs and those things, a practice manager absolutely needs to be aware of. They need to be aware of the call coverage requirements. They need to be aware of the medical director requirements because likely they're going to be closest to the work with that provider. When it comes to call coverage, likely ER management is going to have to be involved. And as far as the approval of the timesheets, it can't really be the practice manager. It likely is going to have to be a vice president, chief medical officer, someone who's got some oversight of that provider to say, yeah, they've performed these duties and we're checking and signing off on that. And ultimately, one that sometimes we forget about, one of the biggest stakeholders is finance. Now, why do I say finance? Well, ultimately, they're the ones that pay the contract. And in most payroll systems, when you have a contract constructed like we just mentioned, there is some manual intervention involved. Things have to be put into the payroll system. And so that's the finance's role, the finance department's role. Here's the challenge. The finance is also your last line of defense to make sure you haven't accidentally paid something that is inappropriate. So while finance needs to be involved in the conversations of constructing the contract, they also need to be very involved in how you're going to operationalize this. And maybe one of the most important pieces with finance is in actually empowering them. I know that in the past at different organizations, I've had conversation with the finance department that if all of these boxes have not been checked, if timesheets haven't been approved, if we haven't gotten a signed off call coverage sheet, you may not pay a physician those components. Sometimes they're under pressure from others in the organization who just want to keep the providers happy because things maybe haven't been flowing as smoothly, and they say, hey, we've got to get this paid. We'll get it signed later. And I've told finance the answer is no. You may not do that. And if there's an issue, that's not a battle for you to fight. You direct those people to compliance and we'll have that discussion. Because the last thing you want to do is to pay something inappropriately and then have to go back to the provider and try to claw it back. That is never a fun situation for anybody. So, anyway, as we have this conversation, I think you can see that operationalizing is not a simple piece of the contract lifecycle with physician compensation, but it is a vital piece. It is an important piece, and we want to make sure that we do it right. Next week, we'll continue this conversation. And in the meantime, if you think of any questions that you would like to ask, then we'll answer them here on this newsletter. Let me know. Have a great day.